So I have Maya, who's a 13-year-old girl who's been diagnosed with papillary thyroid cancer, which is a cancer in the thyroid gland in the neck. She is considered stage 1 because of her young age and that the cancer has not spread to distant sites. So my treatment plan for her is to start with surgery to remove all or most of the thyroid gland and just as much cancer as possible. I would also recommend hormone replacement therapy to make up for the lost thyroid and the hormones that it would produce. Within 12 weeks of surgery, tests should be done to figure out if the thyroid cancer remains in the body. This may include thyroid globulin tests and the whole body thyroid scan. A whole body thyroid scan is done to find areas in the body where thyroid cancer cells were not removed during surgery and could be dividing quickly. Chemotherapy would then be used, either chemotherapy or targeted therapy to destroy the rest of the thyroid cancer that was not removed with surgery. And a whole body SPECT, which is a single photon emission computed tomography scan, may be done 4 to 7 days after treatment. So one of those types of scans. And with targeted therapy, tyrosine kinase inhibitor would be used. So why I chose this treatment and how it would work is, so this plan was partly recommended by the National Cancer Institute for children with papillary thyroid cancer, which fits Maya's cancer description. As Maya is in stage 1, her cancer should be very local and easy to remove using surgery. Surgery isn't the most recommended for children, but again, because she is in stage 1, it would be a more less side effects for her, and it would be pretty simple. Chemotherapy is very commonly given to children as they respond well to it compared to adults, and other therapies like radiation can often be damaging, like radiated lead, so that wouldn't be as recommended to her. Chemotherapy uses chemicals that target and kill fast-growing cells in the body. Since cancer cells grow and multiply much more quickly than other cells in the body, chemo drugs are effective at destroying them. This goes the same with tyrosine kinases, I'm sorry if I'm saying this wrong, which they target cells and inhibit them from cell signaling, growth, and division. And the hormone replacement therapy is to replace the hormones that the thyroid would have developed so that the rest of her Maya's body doesn't suffer. So a typical treatment session would entail getting her vitals taken, like blood pressure, BPM, and weight. She would be asked about symptoms, and blood would most likely be drawn just to do screenings for that, for cancer. And she would receive either targeted therapy or chemo, depending on which her body reacts better with. One medical professional who would assist is a pediatric oncologist, which is a doctor that specializes in treating children with cancer. A pediatric oncologist works with other pediatric health professionals who are experts in treating children with cancer and who specialize in certain areas of medicine. They would meet with Maya for all of their primary visits while diagnosing her cancer and planning her treatment. The pediatric oncologist would definitely check in to see how her treatment's going, but they wouldn't be there to deliver the treatment personally. Life for Maya after treatment. So while having chemo or targeted therapy, she might have some symptoms like hair loss, fatigue, lack of appetite, or more, but once she stops having chemo or targeted therapy, her symptoms will start to fade, her hair will grow back, and she'll start to feel like how she did before cancer. And this is with chemotherapy. Targeted therapy and chemotherapy do have different symptoms and slightly different treatments, but basically Maya's going to intake a drug that targets the cancer to try and destroy it so that she is cancer free. Short-term side effects for chemotherapy include nausea, vomiting, diarrhea, hair loss, loss of appetite, fatigue, fever, mouth sores, pain, constipation, easy bruising and bleeding, and long-term side effects include damage to lung tissue, heart problems, infertility, kidney problems, peripheral neuropathy, nerve damage, and risk of a second cancer or her cancer coming back. So these side effects relate to treatment, as chemotherapy kills off quickly dividing cells. Hair cells and skin cells divide quickly, so they would be damaged because of that, and her body's going to be using a lot of energy destroying the cancer cells, so that explains fatigue, and just any new chemical being introduced to the body can cause the body to react. So that's the majority of the other side effects, but obviously it varies per person. And other medical inventions, sorry this is going on long, that might help Maya feel better is really, it kind of depends again how Maya's feeling, but exercise, like not too strenuous, but just to get active, might help Maya feel better, along with healthy eating, drinking plenty of water, getting lots of sleep, and more specific treatments would be like yoga, acupuncture, or psychological therapy to help her deal with having cancer as a child, which can be it is a really big deal, and can definitely, Maya should talk about it and try and cope with it in whatever way she feels necessary. So that's Maya's treatment. Thanks for watching.